Okay. Hi, everyone. My name is Sonal Desai. I'm a pediatrician at the All of You Medical Center Hub Clinic.
And I am Corinne Van Groningen. I'm a fellow physician at UCLA in the Preventive Medicine and Public Health program.
Hello, I'm Christine. I'm a patient navigator, and I am from Planned Parenthood of Pasadena, San Gabriel Valley. Happy to be here.
So today we're going to be talking about the Reproductive Health Navigator program that we've piloted at our Hub Clinic at All of You.
So to give you a background on why this program was created and the need that it serves, children in foster care are a group with specialized healthcare needs, and so much so that the American Academy of Pediatrics has published extensive guidelines on how to care for youth in foster care. And these children are a uniquely disadvantaged group. So prior to foster care, the vast majority of these patients lived with families devastated by substance abuse, mental health disorders, unemployment, violence, and involvement with the criminal justice system. As it pertains to sexual and reproductive health, foster care youth who are in foster care also experience unique needs. So youth in foster care experience increased risk of early sexual activity, pregnancy, and teen parenting. And females in foster care are more than twice as likely as their peers not in foster care to become pregnant by the age of 19. And within California, where we run our program, 26% of young women in foster care will become pregnant by age 17. And lastly, the study of social policy states that around 23% of children within the foster care system identify as LGBTQ. And so this is a significant portion of patients who need that added specialized and unique care that's LGBTQ plus focused. And lastly, when we're talking about unique needs of the health of youth in foster care, we can look at sexually transmitted infections or STIs. So compared with peers, youth in foster care are at least 3 times more likely to have certain STIs. And as it pertains to young women, those are chlamydia, gonorrhea, trichomonas, genital herpes, and genital warts. And for men, it's chlamydia and gonorrhea. And then within a subset of patients, some of our patients are at a possible increased risk of contracting HIV.
So with this information in mind, our clinic at All of You was inspired to address some of these discrepancies. And we've been very lucky to be funded by both the UCLA Pritzker Center as well as the LA Rep Project. So to give a little bit of background about our hub clinics, there are various hub clinics all throughout LA County, ranging all the way up from Lancaster all the way down to Torrance. And we are a medical home system for all youth in foster care throughout LA County. Any child that is removed from their home and placed in foster care is required to come to the hub clinic for at least 1 medical exam, and they have the ability to continue with primary care services in our hub clinic. We also have the ability to evaluate for physical and sexual abuse, and we also have a wide abundance of ancillary staff and resources. So we have the ability to link to mental health services, and we have some amazing social workers and case managers who can also help with other needs of this population. So starting in January, we decided to pilot our Reproductive Health Navigator program. Together as a team, we came up with a curriculum that would train our navigators in topics such as family planning and contraception, puberty, menstruation, and a wide variety of other topics. And after they completed their training, we were able to integrate our Navigator program into the clinic. Due to COVID, a lot of our services were transitioned to virtual. So we did have all of our navigators call any patient over the age of 12, regardless of their need, to offer their services and explain their role, as well as give a little bit of background about their hub clinic appointment. If the patient agreed, the navigator would set up a counseling session with them at a later time to discuss the topics that I mentioned previously. And we also had our navigators call patients 1 to 2 weeks after their medical visit in an effort to create a relationship with the patient and foster a sense of confidentiality and trust. So we were able to hire 2 UCLA graduate students last fall. They completed their training and started calling patients in January of 2021. We were able to engage 42 foster youth in pre-visit phone calls, and 29 of them agreed to counseling sessions. And topics that were covered included things like contraception, gender identity, the importance of sexual consent, and we did make a very conscious effort to include LGBTQ plus healthcare topics as well.
And so after a 6-month pilot, we, in concurrence with our exiting health navigators, really tried to evaluate our program and identify areas for improvement. And so right now I'll talk about 3 areas that we have thus far identified as we move forward with the program. So the first is increasing our onboarding educational modules. So as Dr. Desai said, the health navigators will go through an online health access course, which is great, but unfortunately it's very medical heavy, contraception heavy, and doesn't include a lot of the topics that are still very important for the care that we provide for youth in foster care. And so as such, we've created additional educational materials in the form of PowerPoint slides to make our education more robust for our health navigators. And the lectures that we've created thus far are on topics such as trans and sexual minority health, again, to improve the LGBTQ plus centered care that we strive to provide. And then modules we're currently working on are modules to identify sex trafficking, topics on men who have sex with men and PrEP, and then of course, trauma-informed care, which is central to the care that we provide. Second is increasing our patient engagement. We found that within the telehealth and over the phone medium, which is what we have to do right now, unfortunately, because of the ongoing pandemic, that we've had a really hard time getting youth to get on the phone with us to complete the counseling session. And so in conjunction with REP, we're going to reach out to the Youth Advisory Board with a questionnaire to assess how we can better engage our patients. And lastly, as we think about making this program sustainable, we would ideally love to have former foster youth step into this peer and health navigator role. But in doing so, we need to make sure that we have an environment that promotes emotional safety and adequate support for these individuals. So that's an ongoing process as well. Currently, where we're at in next steps, we are happy to report that we're onboarding a new health navigator. She is a master's in public health student at UT Still. She's also going to help us with our program evaluation and development. She'll be with us longer than our pilot health navigator, so she'll be with us for 1 year, and then she's going to start services this fall. So we're very excited about that. And then Dr. Desai is also working on creating a hub clinic that is specific just to teens and adolescents. And so having this one clinic where we have all the adolescents there will allow us to provide in-person counseling and health navigation services, which I think would just be so much better for our program and the care that we can provide for our patients. So we're really looking forward to that. Here are a few of our references, and then we'll go ahead and pass it along to Christine.
Awesome, thank you so much. So my name is Christine. As I mentioned, I'm a patient navigator here at Planned Parenthood Pasadena, San Gabriel Valley. And I'm just gonna talk about how we see the RHEP program implemented at our health center. Next slide. So I'm going to talk about, well, what is Planned Parenthood Pasadena, San Gabriel Valley? I like to explain that here at our affiliate, as we call it, we are not all of Planned Parenthood. We are a specific service area. That's how I like to explain it. And so in our first bubble, we see the health centers that we do manage. So we have a health center in Pasadena, in Alhambra, Glendora, Baldwin Park, which opened in late 2020, and our newest health center, which is Highland Park, which opened earlier this year in 2021. And we have very flexible hours here at our affiliate. We are open Monday through Saturday, and we have different hours where we're either open early in the morning or we close later during the day, just so we could have more flexibility and accommodation to our community. The next bubble that we have is, so I'm a patient navigator. I do the navigation for the youth, trying to reach out to specifically foster youth. And so within this role, these are the most common appointments that I've noticed youth do attend here. So we have birth control, abortion services, infection checks, STI testing, and pregnancy tests as well. Those are the most popular among youth. And then we also have other services here for people 18 and over, such as gender affirming care. We have a hormone replacement therapy program. We have HIV prevention, and we're also providing the COVID vaccine to community members. Next bubble we have is just the health insurances that we do accept. We do accept Medi-Cal, we accept Kaiser for abortion services, and for people who do not have insurance or for youth who want their insurance to remain confidential, we enroll them into the Family Pact program to cover the services for birth control and STI testing and treatment. Next slide. And what I'm going to talk about now is how we implemented patient navigation into Planned Parenthood San Gabriel Valley. So a lot of the methods and practices that we use here for youth patient navigation, we took from the ARROW, which is our gender affirming care, and HIV patient navigation. So both those programs have patient navigators. I started my role here as an HIV prevention patient navigator, and I've now transitioned to just a patient navigator where I could provide navigation for our gender affirming care, HIV prevention, and as well as youth. And so in our big square, we have basically the things that we have implemented to reach out to patients. So what I'm doing is I am reaching out to people before their appointment, and what we got from the other programs is we have an intake form and a screening process just to make sure that people are appropriate for this service. What I'm doing is I am contacting youth who are under the age of 18, so all patients 17 and under who are going to come into our health center. I check in with them before their appointment, and I just introduce myself. I introduce my role and how I can best support them. And I ask them questions about, if they have, if they anticipate any barriers for transportation. So I can help guide them of like bus schedules, or if they're in foster youth, help them get connected to a transportation service to get them to their appointment. I'm also answering their questions that they might have and just providing an overview for the appointment just so they know what to expect and how to prepare. For example, if somebody's coming in for an IUD insertion, I do let them know that they're going to have a pelvic exam and to anticipate that during their appointment, just so they're not kind of caught off guard when they come in for this. After that first initial call, I do send a welcome email providing a youth resource guide and reproductive health rights for youth, and just encouraging youth that if they have any questions or concerns, they can definitely reach out to me. So I just try to build that open communication of, I'm here to support them with their needs here at Planned Parenthood. And then after they attend their appointment, or if they've missed as well, I do still check in with folks through a phone call just to see how their appointment went, answer any questions, book them a follow-up appointment if needed. And if they did cancel or miss their appointment, just check in with them to see if they would like help rescheduling. Through all this work, my main goal is to build trust and become a trusted point of contact so that hopefully in the future, if somebody needs a service or something is going on with their body that they want to just kind of check in about, they can definitely reach out to me. If I don't have the answers to a medical question, we do have registered nurses on my team, so I'm able to connect the youth to the registered nurse to talk about specific health needs. And as of today, we did start implementing this program in June. And as of today, I have reached out to already 200 youth by phone contact. Next slide. And so it's been great reaching out to youth, but we have found some challenges already. And in my think bubble, this is something that I'm always trying to think about how to navigate is how do I contact youth in group homes? That's always a difficult part because there's usually not a direct contact with that youth. And my goal is always to get in contact directly with the youth. One, I want to make sure that this is a service that the patient is consenting to and make sure that they have the information as opposed to, relaying information, but also just trying to make things confidential for that youth. But as I mentioned, with group homes, it's kind of hard to get that direct contact. Sometimes I'm trying to connect the dots of workers to try to see who can connect me with the patient or not available, or maybe sometimes the phone number, I'm not able to leave a voicemail, so I can't really get in contact. So the ways that we are trying to manage this is we're trying to just make my contact information more visible and more accessible. And so what we're thinking about is on the left side, we have updating our website to inform about patient navigation. We do have it on the website right now, but we think that it could be a little bit more accessible and a little bit more obvious instead of like trying to click to get that information, just kind of have it on our website. As I mentioned, I do send the welcome emails, and here at Planned Parenthood, we do have an option to send just a reminder email about appointments, but we're also thinking about us sending a specific youth automated message, text message to youth, providing my contact information. So if anything happens before their appointment, they can get in contact with me or also have my number after their appointment. And in regards to the group homes, we are trying to build connections with leaders in the group homes or staff who are consistent in the group homes so that the people in the group homes know that they can contact me directly to connect people to services and answer questions if needed. So hopefully through doing those things, we can have an easier communication with the youth directly. Next slide. And I want to talk about now, we heard about the hub and how they worked, and I want to just talk about how we have all collaborated within the RHEP program. So on the left side, we have our collaboration with both the hub clinic, Seedling, which is helping us with data collection, and the National Center for Youth Law. This is what I call our external network, our external partners who have really been helping us throughout this process. We got a lot from the hub clinic during our work group meetings. They really shared a lot of what they have done, and we used their example to implement it into our health center. We attended nickel meetings about the youth in the foster care system, and I've also attended a lot of trainings like the hub mentioned about contraceptives, puberty, and menstruation, just so I could have that information to give out to youth. And like I mentioned, we're always sharing information. It's more of like a feedback and a work group where we're just sharing ideas, brainstorming. If we have a challenge, we bring it to each other and we just give each other ideas so that we could hopefully create a better solution to what we have right now. So we took all this information from our external networks and we brought it into our own health centers here at Planned Parenthood. Here at Planned Parenthood, we're our own organization and we have lots of different departments. At the top, we see our first point of contact is our contact center. That's where people call to make an appointment. We have our clinical staff, which are attending patients. We have our IT department. We have education. We have specific medical assistants who specialize in youth. And then we have our front office staff. And so what we did to really make sure that the rollout of this program was effective is we met with all of our health centers and we just told them about the program, but then we also asked them for their feedback or what they thought would be most effective to serving youth. And they told us that most youth are just not really educated or don't have the language or are embarrassed of using certain kind of language to talk about their sexual reproductive health. So I'm trying in my first initial contact to just see what the need is and just help them talk about and normalize, talking about needs regarding sexual health. We also have done a lot of trainings focused on youth care, but also trainings focused on trauma-informed care. We're hoping that if we become more trauma-informed, we can also serve our youth better and specifically foster youth as well with the trauma-informed lens. We also adapted youth-friendly practices. As I mentioned, we have our medical assistants who specialize with youth services. They have a youth safety assessment form that we looked at and we felt that it was a little bit dated. It needed to be revised and revamped to really fit the needs of the youth that we're trying to serve. We implemented more gender neutral language and just language that wasn't like checking a box, more of like a conversation. And all these practices we are doing, and we're still having trainings. We are still trying to figure out ways that we could evolve this program. We're all doing this to hopefully sustain this program so that maybe by the time that this grant is done, we can still have this program implemented or the practice implemented for the long term. And yeah, I think that's pretty much my part. We just have time for questions now. We appreciate everybody who's been there. But yeah, does anybody have any questions for us about the things that we discussed?
Great. Well, thank you so much for coming. We're really excited about these projects that we're working on and partnerships. So yeah, it's been great. Yep.
Yeah, we do have one question from Kate. For the Planned Parenthood San Gabriel Valley work, how do you engage with the community when a patient needs services outside of a PP setting?
Great question, Kate. So we do have a resource guide that I had developed, providing outside resources such as food, housing, mental health services, work services, employment services, immigration. We do have a resource guide that is youth focused in all those areas of support. So if a youth is telling me, oh, I need help with job training or I'm looking for a job, I can connect them or I can refer them to our youth resource guide. And I would actually kind of do a little extra step and just work with them a little bit to let them know where they could find that and encourage them that if they have any questions or if they would like help with that process, just because I know sometimes making that first call to a resource can be intimidating, especially if you're a youth. Letting them know that I'm here to support them with getting connected to an outside resource. But yeah, to answer that question, it would be our youth resource guide that has lots of areas to support that are specifically youth focused.
And I see we have the same question for our clinic as well. We have a similar flow as well. Our navigators have a wide variety of resources in their pocketbook to refer. And we as providers generally just love referring to Planned Parenthood as well. So I think that's a common one. And we're lucky to have social workers and case managers in our clinic who also are able to provide patients and caregivers, if needed, resources as well.
Great, thank you so much. Did anybody else have any questions? Great, well, it is a smaller group, so we'll stay on here for a few more minutes until the session ends, but please, if you have any questions, feel free to drop them in the chat or send them to me via direct message.
I think we're gonna head over to the main room if that's okay.
Yeah, absolutely. I was just about to say that. Thank you so much again to our speakers. And this session will be recorded and it will be up here on Excel events for the next, I believe, like 90 days. So folks can always come back to this video. But yeah, thank you again. And you can head back to the main stage.
Okay, awesome.
Thank you.
Thank you so much. Thank
It
you,
was good seeing you,
Kendra.
Christine.
Thanks. Great job, y'all.
Yeah.